Hello, I'm Dr. Inman. This is a lecture on strangles in the horse. Strangles is an upper respiratory tract infection, bacterial in nature, that basically involves the upper respiratory tract of the horse. It also can involve the lung field and ascend down, or actually move down into the lung field, but it is essentially an upper respiratory tract infection. The problem with strangles is that the bacterium will decide that it's going to reside, if you will, in the regional lymph nodes, as it has here, and very commonly the infection becomes so inspissated or caseous that it really can't get adequate blood supply to it, and then what it does, the only thing it can do is burst through the skin and produce a hole in the side of the horse's neck. Also, as these lymph nodes get inundated with the bacterial growth, essentially, it'll compromise the animal's ability to breathe, and therefore we get the word strangles, okay? So the condition is a nasty bacteria that basically the body doesn't have the ability to take care of, and the bacteria grows inside of a lymph node that has poor blood supply. The treatment that we'll use for it, of course, is we'll originally adjust these animals as we always do, but our approach is always going to be to treat these infections like an upper respiratory tract infection or a lower respiratory tract infection like a bronchopneumonia with laser frequency. And the goal here of laser frequency is, of course, 784 to kill the bacteria, actually to address the body's ability to attack the bacteria, but also it's imperative for us to get the body to communicate to that area, including the lymph node where a majority of these bacteria are actually residing and taking up space essentially without being inundated by the body's immune system that'll attack and get rid of them. We'll also use frequencies to increase the blood supply, 100, 4, 100 also helps the lung field, arterial for 100, 4 for venous, 300 for capillary. We'll use those frequencies. We'll also use a frequency 784 for infection, of course, 230 for lymphatic drainage, and for the lymphocyte system it's 73 cycles per second that we'll use. We use a number of these frequencies. We can program four of them each time we do a 180-degree set. So we may have to do 2 or even 3 sets of frequencies, essentially, at about 180 seconds apiece. That means that the therapy itself takes about anywhere from 6 to 9 minutes. We do it twice a day for 3 days and aggressively treat this animal. We can laser them twice a day in an hour interval, well, not less than that. So we can't laser them and laser them again 45 minutes. The body sees it as the same lasering. But if we wait at least an hour, just like we did when we were told when we were kids, couldn't go in after swimming, essentially. If we wait an hour, then we can laser them again, or we can wait 10 hours, it doesn't matter. But twice a day for the first 3 days actually puts us weeks ahead of schedule and actually brings the body's attention to the site, blood supply and lymphatic drainage to the site, and allows the body to attack it. We would strongly recommend that when you utilize laser to do this type of therapy, to not rely specifically and solely on the laser, although it has been successful. More often than not, we want to make sure that we're lasering these animals with a concomitant antibacterial therapy to make sure it doesn't spread to the rest of the body or the lower respiratory tract for a bronchopneumonia. So we want to make sure that we laser and use antibiotic therapy at the same time. If you are a veterinarian, you're already using antibiotics. If you're working with a veterinary affiliate, essentially they're using antibiotic therapy and probably topical to take care of the potentiality of this. This is a very severe case when we end up with it blowing out the side of the head and producing this type of condition. By the time the animal is diagnosed with strangles, the animal's having troubles breathing sometimes, and then the veterinarian will see within 2 or 3 days that those lymph nodes will get huge and make the animal an acute problem, and so the vet's usually called out on that after it's been on board for several weeks. We would have you go ahead and go to the vomtech.com website, where we show you a whole series of disease processes that we're successfully able to treat with frequency-specific low-level laser therapy. Treating this condition with a class 4 laser, essentially, is not necessarily indicated, even though it can in fact cook this tissue and cook some of the bacteria. With the laser, it's not going to get all of it. Essentially, it never can get all of it, and it basically will not allow the body's immune system to move into the area and solve the problem. So although it seems like it would be a good idea, class 4 laser actually just prolongs the problem, essentially. And what we do with a class 2A laser, which is frequency specific, which doesn't cook the bacteria, it induces the mitochondrial DNA of the actual killer T cells and also other cell-mediated immunity to attack the bacteria and get rid of it, essentially. And so it's a solution as opposed to a temporary fix. So we want you to use a frequency specific low-level laser therapy, and it's actually safer, quicker, more effective. This has been a lecture on strangles in the equine essentially, and I would have you go to the bombtech.com website and look up frequency-specific laser therapy essentially, so you can get an idea of what it is that we can do. About 2,700 different disease conditions we've mapped out clinically for this technology. Thank you, and have a great day.